Gentlemen, I want you to picture waking up tomorrow with the kind of firmness you haven't felt in years. No pills, no pumps, no risky procedures. Just your own hands and a few minutes of simple, precise stimulation to reawaken your body's natural erection mechanism. I'm Dr. Valeria Mendoza, a urologist with over a decade of experience helping men restore sexual vitality. Today, I'm going to walk you through 3 specific pressure points on your manhood and the surrounding area that can help bring back morning erections by improving blood flow, relaxing the right muscles, and boosting nerve responsiveness. If that automatic morning rise has been missing, stay with me. By the end of this video, you'll know exactly where these points are, how to stimulate them safely, and how often to practice for real results. Before we talk about the where and the how, you need the why. Once you understand the science behind this, you'll realize you're not merely pressing on skin. You're tapping into one of the most powerful systems in the male body. Erections aren't random or purely mechanical. They're the product of a carefully coordinated dance between your brain, spinal cord, blood vessels, nerves, and muscles. It begins with nerve signals, tiny electrical messages racing from your brain or sensory nerves to the erectile tissue. Those signals cue the smooth muscle inside the penis to relax, letting blood rush in and fill the spongy chambers known as the corpora cavernosa. As they fill, the veins that normally drain blood are compressed, trapping blood and creating firmness. Here's where age changes the equation. Over time, blood vessels in the pelvic region can stiffen as arterial walls lose elasticity, accelerated by everyday wear and tear, low-grade inflammation, or conditions like high blood pressure. At the same time, nerve conduction slows, so those electrical messages don't travel as quickly or as strongly as before. This 1-2 punch, sluggish circulation and weaker nerve signals, is a major reason morning erections fade after 50 or 60. Targeted pressure point stimulation works because it sends an immediate wake-up call through your nervous system. Pressing or massaging specific spots activates clusters of sensory nerve endings that feed directly into reflex pathways tied to erection control. These signals don't stay local. They travel to the pelvic nerve plexus and up to the sacral region of the spinal cord, the erection center. That triggers a chain reaction. The nervous system tells smooth muscle to relax, arteries to widen, and blood to flow more freely. And it doesn't stop there. Some points also influence the pelvic floor muscles, the hammock-like support that stabilizes the penis during erection and helps control ejaculation. Stimulating these areas can improve tone and responsiveness, making it easier to maintain firmness once you have it. This is why pressure point work often has a twofold effect. It helps you initiate erections more easily and hold them longer. In other words, pressing the right spots lets you bypass some age-related slowdowns and give your erection system a direct, hands-on boost, like resetting a slow computer, clearing the lag, refreshing the signal, and getting hardware and software working in sync again. Practiced regularly, this stimulation can retrain erectile reflexes, improve vascular flexibility, and enhance nerve sensitivity over time. The first point is the base groove, sitting at the root of your manhood, where the shaft meets the pubic area. To locate it, run your fingers along the underside of the shaft toward your body. You'll feel a slight groove or indentation, a natural hinge where erectile tissue blends into deeper structures anchored in the pelvis. This spot may feel subtly different, slightly firmer or more textured, because important anatomical structures meet here. Why does this matter? Beneath the skin lies a dense network of sensory nerve endings, including branches of the dorsal nerve of the penis, along with key blood vessel junctions that feed directly into the erectile chambers. Think of it as a control hub where nervous and circulatory signals converge. By stimulating this area, you're lighting up both pathways at once, improving communication between your brain, spinal cord, and manhood. Gentle but deliberate circular motions at the base groove send 2 messages. To your blood vessels, open up and let more flow through. And to your nerve fibers, wake up and transmit more efficiently. This primes erectile tissue to respond more quickly when arousal signals arrive, whether in the morning or later in the day. How to do it? Place your thumb directly on the base groove while your fingers cradle the back of the shaft. Start with moderate pressure, enough to feel tissue under your thumb, never to the point of pain. Make small, slow circles, letting warmth spread through the area. As the tissue softens and relaxes, you can gradually increase firmness. You may notice pleasant warmth, subtle tingling, or a sense of fullness, your body's way of saying blood flow is rising and erectile tissue is responding. If you don't feel much at first, don't worry. Consistency is key. Over time, daily practice heightens sensitivity and results become more noticeable. For best results, work the base groove every morning, ideally before getting out of bed when your body is relaxed, or in a warm shower, where heat has already softened tissues and improved circulation. Over the coming weeks, this precise technique can retrain erectile reflexes and help restore strong, dependable morning erections. The second point isn't on the shaft. It's in a slightly hidden, often neglected area, the perineum, often mispronounced perineum. This is the soft, springy patch of tissue between the scrotum and the anus. Many men ignore it, but for erection strength and control, it's a powerhouse. Why? It sits directly above the bulbospongiosus muscle, often written bulb spongiosus, a key pelvic floor muscle that helps trap blood inside the penis during an erection. Think of it as a natural clamp preventing blood from escaping too quickly. With age, if this muscle isn't engaged, it weakens, making it harder to maintain strong erections. Applying targeted pressure and massage to the perineal spot reflexively activates this muscle, essentially giving it a workout without a full set of Kegels. To find it, sit comfortably or lie back with knees slightly apart. Using 2 fingers, index and middle, press gently but firmly into the center of the perineum. Not enough to cause discomfort, but enough to feel the underlying muscle respond. Move in slow, deliberate circles, staying centered on the sweet spot. As you massage, you may feel warmth radiate toward the penis or a faint pulsing as blood flow improves, your pelvic muscles waking up and circulation responding. Spend 2 to 3 minutes here with steady, controlled touch. For an extra boost, pair this with light pelvic floor exercises, Kegels, before or after the massage. This combo trains the muscle to contract more powerfully during arousal, making erections feel fuller and more dependable over time. Out of sight doesn't mean out of mind. The perineum is crucial for restoring morning vitality. The third and final point is in one of the most sensitive regions of the male anatomy, just beneath the head of the penis, at the glans, specifically the ring-like ridge where the glans meets the shaft called the corona. This area is packed with an extremely dense concentration of sensory nerve endings, the main messengers that send arousal signals to the spinal cord's erection center. When stimulated with the right balance of pressure and rhythm, this point heightens nerve responsiveness, making it easier to transition from arousal to a full erection, like tuning your arousal circuitry so it responds more efficiently when needed. Control is everything here. Too much intensity can overwhelm nerves and backfire. To work it, gently hold your manhood with thumb and forefinger on either side of the corona. Lightly pinch the ridge and hold about 5 seconds, then release slowly. Repeat this hold and release for roughly 1 minute with firm but comfortable pressure. Next, switch to slow circular motions around the entire circumference of the corona, letting your fingers glide just enough to stimulate without causing friction irritation. This second minute of circular work further wakes sensory pathways, encouraging faster signal transmission between penis and brain. With consistent, moderate, rhythmic stimulation of the glans ring, many men notice stronger, more frequent morning erections and improved sensitivity during intimacy. Arousal feels more natural and spontaneous. Remember, this isn't about overwhelming nerves. It's about gently reconditioning them to respond more like they did in younger years. A daily reminder of how coordinated blood flow and nerve signaling should feel. For the best results, treat these 3 points as parts of one intentional routine, not isolated tricks. Here's the sequence I recommend for maximum benefit. Begin with the base groove for about 90 seconds. Small, steady circles until the area feels warm and responsive. Then move to the perineal spot for 2 minutes, pressing and massaging in slow, deliberate circles to activate the pelvic floor and encourage deeper circulation. Finally, finish with the glans ring for another 2 minutes. Use the hold and release technique, then gentle circular strokes to reawaken nerve sensitivity. Done back to back, this sequence boosts blood flow, engages muscular support, and sharpens nerve communication. The key elements of firmer, more reliable morning erections. Let's set the right expectation. This is not a magic button that transforms things overnight. Your body needs time to adapt. to retrain vessels, muscles, and nerves to work together again. That said, many of my patients notice subtle but encouraging changes within 2 to 4 weeks: more warmth and fullness in the mornings, erections that last a bit longer, and a general sense of increased pelvic vitality. For lasting improvements, pair this daily pressure point routine with healthy habits. Stay well hydrated throughout the day to support blood volume and circulation. Keep your pelvic floor strong with Kegels to amplify firmness from this technique. And don't underestimate smart nutrition. Build these steps into your daily rhythm and benefits tend to multiply. The points grow more responsive, circulation improves, and your body remembers how to perform the way it once did. You're creating an environment where strong, natural erections happen more easily, safely, drug-free, and fully within your control. Gentlemen, you don't have to accept weaker or disappearing morning erections as a normal part of aging. Your body can still respond. It just needs the right stimulation and support. By pressing these 3 points daily, you can retrain nerves, restore circulation, and bring back that morning confidence without drugs or risky procedures. If this helped, make it part of your routine and let me know what you notice. And remember, your sexual health reflects your overall health. Every step toward better circulation and muscle tone pays off in the bedroom and beyond.